Welcome back. Do you have an ache or pain that just won't go away, or an injury that just doesn't seem to get any better? It's important to see an expert without too much delay. Dr. Kris Parchuri of the Spine and Orthopedic Specialist is here this morning with some great advice. Doctor, thank you, and welcome to the show, by the way.
Good to be here.
We were just talking about the fact that, weather forecast calls for some more outdoor weather. A lot of folks are going to be outside more. That increases the amount of injury we see.
Yes, as the weather gets warmer, people tend to become more active, and what ends up happening is that people tend to want to go for a 5-mile run when they've been sedentary for the entire winter, and unfortunately their body hasn't acclimated and they tend to injure themselves.
So a lot of the injuries you see are due to outdoor sports or just being more active outside. At what point do you think you need to see, if you hurt yourself, if you have an ache or pain in one of your joints, what is the point that you need to see a doctor?
Well, fortunately most injuries do just simply get better with use of rest, anti-inflammatories like ibuprofen, and just a return to gradual normal activities. The injuries that linger and where the pain bothers you at night, where you're having trouble sleeping, you're having trouble resuming normal activities, those type of injuries or pains need to be further evaluated by a specialist. So if you have a pain that tends to linger for more than a few weeks or is just excruciating, I definitely would seek medical attention.
You guys look at the x-rays and do all those things like that. Now, what if you do require surgery? What kind of time frame are you looking at when somebody goes in and let's say they need something on one of their joints or their knees? I mean, is it a pretty quick process once you decide what is wrong with the patient?
Well, there's very few indications for emergency surgery, so most of the time we like to try what's called non-operative or conservative treatment, where you do medications, you try physical therapy and those type of modalities. If those things fail, which is typically anywhere from 6 weeks to 12 weeks, then surgery is indicated, and surgery can range from rotator cuff repair to ACL reconstruction to back or neck surgery. I mean, there's a wide variety of surgeries out there for sports-related injuries.
You and me and many adults, even though it's the summertime, we're still spending a lot of time indoors because we have jobs. But the kids, they're outside a lot too. What are some of the more common injuries you see with the kids over the summer?
Well, kids are very resilient, so fortunately most injuries are minor and they can heal quickly. But unfortunately a lot of the injuries that we do see with kids are related to blunt trauma. So, if they're just horsing around and they fall, they hit their head, they hit their shoulder, they get a contusion. And so a lot of it's just blunt trauma, so it can be fractures and those type of injuries.
With the kids and the adults, if you have any doubt, it's best to obviously go in instead of waiting, especially if it's excruciating pain.
With children, because they're not able to verbalize or communicate adequately their symptoms, I would seek medical attention immediately. Okay.
Is it usually that they will come see their primary care physician and then you get kind of referred to, or is it a lot of times they'll go right to somebody like yourself?
No, it's easier for children to get in to see their pediatrician or primary care, so therefore I would recommend that route. For an adult, I mean, you can verbalize your symptoms more effectively. I'd go to see a specialist.
So it's easier for you to kind of figure out what's wrong with an adult, a lot easier than the kids at first. Okay.
Absolutely.
Very cool. Want to let everybody know, by the way, you're a proud graduate of Kansas City, so
yes.
You went up there and so how many years do you have experience?
I've been practicing now for 6 years as an orthopedic surgeon.
And you were in Tulsa, you left and you're back, so you're proud to be back here in Tulsa.
Yes.
Very cool. I want to thank you very much for coming on the show.
Thanks.
I want to give everybody some information for you. Spine and Orthopedic Specialists, these are the guys to go to if you have these type of injuries, or you think you do. 9101 South Toledo Avenue, Suite B, 539-644-4448.